Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, Metro Manila and Laguna will shift to a more relaxed, modified ECQ starting August 21. But with the rising COVID-19 cases and hospitals getting full due to the Delta variant, is relaxing quarantine restrictions a good move? And later, a presidential advisor pushes for malls, restaurants, and buses that would cater to fully vaccinated people only. Former COVID-19 Task Force Advisor Tony Leachon and Presidential Advisor for Entrepreneurship Concepcion joins us live. President Rodrigo Duterte approves the recommendation of the Interagency Task Force to place Metro Manila and Laguna under a more relaxed community quarantine, or MECQ. The new quarantine status will take effect starting August 21, that's tomorrow. Bataan will also shift to MECQ beginning August 23. The decision comes as the country continues to log high COVID-19 cases. The Health Department reported 14,895 new coronavirus cases Thursday, the second highest single-day tally since April 2. Let's go straight to the source of the story. First off, Presidential Advisor for Entrepreneurship, Concepcion. Mr. Concepcion, welcome to the source, and thank you so much for your time.
Good morning, Pinky.
First, your reaction to government's decision to place NCR under MECQ.
Well, it's not a surprise, no, because as we can see, the cases are still somewhere there. No, it's trending slightly upward, but for a while we thought it was going down. So I think it's correct to do MECQ, and I think the private sector will prepare for. The good part is that they announced also that my proposal was accepted, and that will pave the way for less lockdowns to happen in the future.
Mm-hmm. Your proposal, we're going to talk about that a little later on. Just wanted to ask you, because a lot of people are asking the difference of what ECQ was the past 2 weeks to what MECQ will be tomorrow. Definitely, we know, sir, that beauty salons, barber shops, beauty care services, and dine-in and alfresco will not be allowed. That was allowed before under MECQ. So this time it's going to be different. Ano po? However, will the retail stores be open?
I'm not aware. In fact, I'm also waiting for the details of this MECQ, since some changes were made. So, but very clearly that indoor, outdoor dining and all of these salons are not going to be opened, and that's what many are wishing to open up, because many of these people are quite hurt with the lockdown.
So that's what we need to find out still and get clarification. Because before, as I mentioned a while ago, these were open. So let's talk about your proposal. I've seen a number of your interviews regarding fully vaccinated individuals. Let's bring in some good news. According to Secretary Vince Dizon yesterday, almost 40% of the population in NCR has been fully vaccinated. However, sir, today I heard on the radio that Mayor Olivares was saying that 50% of the population in NCR has been fully vaccinated. So this is in line, of course, with your proposal, because sabi niyo po, let's have places for fully vaccinated individuals, such as malls, workplaces, and even transportation. But you said, kailangan there are enough people who are fully vaccinated. What number were you looking at to be able to implement this vaccinated bubble?
Well, basically 50% was our target, and most of the LGUs in NCR. Let me clear, the proposal was only for NCR, are approaching close to 50%, and once that happens, fully vaccinated people only will be allowed to enter malls, restaurants, spas, etc. No? And why is that so? It's very clear that what we have to protect are the unvaccinated people, and they are filling up the hospitals because most of the admittance in the hospitals today are the unvaccinated, as high as 85%. And if you check with many hospitals, the trend is the same. Unlike the vaccinated, yes, they can still get infected. And I've seen many of my friends do get infected. But the difference is that it is very mild, their infection. And most of them will not even need hospital care. No? And that is the difference. So we should use the vaccinated people to do the consumer spending. No? They will be part of the economy. They need to go out so that they can start spending, so that the economy will start moving. So if the dining restaurants are open and the malls are open, that will create economic activity, but you're not exposing the unvaccinated because they are still at risk. No? The moment we cross over and Delta is maybe done, then it can be open to all. But for now, while we are in this situation, it should only be the vaccinated.
But you're saying 50% will suffice for this vaccinated bubble.
That's the start. And I'm sure that they will relate the capacity to the percentage vaccinated. I don't know what that, the details will still have to be drawn up. But by the end of the year, we're hoping to hit between 70 to 80% herd immunity. Hopefully, we can target that by October, November. And that's the goal of NCR LGUs. And that's why bulk of these vaccines are being poured in NCR, no, to really bring up the level of fully vaccinated people. So it is not 50% as the end goal. It is going to be 70 to 80%, especially with Delta variant. You need to target higher, no? 70, 80, even 90%, no? To be able to secure that people will be safe. No?
Yeah, but when is the right time to be able to start these bubbles for vaccinated people? At what percentage of NCR do you think should be fully vaccinated before this can be allowed or should be allowed by government? Are you still sticking at 50% or dapat hubang itaas na to 60%?
I believe 50% is a good start because they can regulate naman the capacity, no? How many percent will be allowed in this establishment. So if you are at 50%, okay, they will relate that to how many percent at 50% will they allow the number of vaccinated. But I'm sure they can allow more because these people are fully vaccinated, not just with one dose, no, with 2 doses. No, that's important. Now, moving forward, I believe this is the way forward to avoiding already lockdowns in the future. We are not the first country to implement such as this. No? Singapore, Indonesia, and many other countries have started to move in this direction to allow greater mobility for the vaccinated. And that's why we met with Secretary Tugade and the transport group a couple of days. Today, there's another meeting to really finalize how we can now bridge. Remember, what we're trying to approach is micro herd immunity. We don't need to wait for the LGUs or the country to hit herd immunity at the national level. We start with the homes, we start with the workplace, we start with the different establishments that they will go to. No, so and what is the missing link right now is transportation. So the proposal that we brought forward to Secretary Tugade is let's look at buses for fully vaccinated people, so that from their home to their workplace to the different establishments, there will be buses for fully vaccinated. So you can contain all of the fully vaccinated people in a bubble whereby the fully vaccinated will also not infect the unvaccinated, because it's possible that the vaccinated people who get contaminated can also infect the unvaccinated.
I understand what you're saying with that. So it needs to have almost like a holistic approach. You have to have a bus for vaccinated people, malls for vaccinated people. In other words, it's really vaccinated people moving from one place to another. It's very important, though, that you mentioned about transportation. What did Secretary Tugade say about this? Is it possible?
It is. Well, Secretary Tugade is a man of action, and he said it's possible. He's appealing to us to try to supply him some vaccines for the drivers and we're doing what we can to do it. I'm asking Secretary Galvez's help also, but more so the bus owners, the bus companies are willing to do it because many of their buses are just in the parking lot. No? So they can
Right.
allow these buses to be used. And of course, there will also be buses for the unvaccinated. No? That these people have work to go to, from home to work, but let's not risk them moving out beyond their workplace now. So that is going to, the meeting today will basically kickstart all the fine details on how this can be implemented. But his undersecretaries are very optimistic that it can be done.
Yeah, it's really looking into what the couple of months could appear. What could happen in the next couple of months? So the thing is, I guess, I know that the fine print needs to be talked about here and the details, but it's as if you're looking at buses that are marked, I don't know how yet, for vaccinated people and buses that are marked for unvaccinated individuals. That's how it's going to appear, right?
That's right. That's right. So it's a bubble basically for the vaccinated from their home to their workplaces to the different establishments that the vaccinated are allowed to go to, and likewise with the unvaccinated from basically the home to just the workplace, excluding the different establishments. Now, this situation will last during a period until we reach maybe 90%. When 90% is fully vaccinated, then you don't need to do this anymore because 90% of the population will be fully vaccinated. So this is a transition to allow, remember, we're entering the fourth quarter pretty soon. So we have to prevent the fourth quarter from being locked down, and that will be devastating. So this bubble, this huge bubble for fully vaccinated and unvaccinated in a separate bubble will allow the economy to open up safely without any more lockdowns.
Yeah. Here's the thing, though, Mr. Concepcion. I'm sure you're also thinking about this because booster shots are being discussed. A lot, of course, the vaccination began sometime in March, and the 30th day would be sometime April because it takes 30 days from one shot to the second shot. Do you see just a possible issue on vaccinated individuals who at some point may have reached their 6 month of vaccination and who possibly lang po, may need booster shots? Is that also something in the pipeline?
Yes, it is in the pipeline. But right now, there is still a lot of Filipinos that are not vaccinated. So the priority of the vaccines arriving will be for these people. But for us, in the dose of hope, AstraZeneca, these are not required because AstraZeneca will last at least 1 year. So my own estimate, we will need these booster shots close to middle of next year. No? Now, in the case of Pfizer and Moderna, from the reports that we read, they're looking at booster shots in America in the next 6 months. No, so but that's all what I see from the news. But basically, we are in discussion with AstraZeneca, but really more towards the middle of next year. At this point in time, we still have AstraZeneca vaccines arriving in February, March next year, which we will focus on the other LGUs that don't have enough vaccines. No, so our vaccines will arrive. Especially the donated vaccines to the government will be arriving sometime February next year.
Okay. Just as a last question, could you give me a number on the number of vaccines that the private sector has received under, of course, the tripartite agreement with government and the pharmaceutical companies?
Well, for the AstraZeneca, that's 17 million doses. That we ordered in November 27 last year, started to arrive on July, and hopefully all 17 million doses will be completed by February next year, which includes the donation that we gave to the government, which the government has given back to us, but has and basically requested us if we wanted to still donate it to the different LGUs. So the difference now is that we can now direct this donation to different LGUs next year. So that's 17 million doses. Moderna, I believe it's about 7 million Moderna doses that should be arriving all before the end of this year. So if you would total that, that would be something like 24 million, thereabouts.
Right.
Yeah.
Okay, Presidential Advisor for Entrepreneurship, Joey Concepcion. Sir, thank you so much for your time.
Thank you. Thank you, Pink.
And we will be taking a short break. Former COVID-19 Task Force Advisor Tony Leachon will be with us. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, former COVID-19 Task Force Advisor, Dr. Tony Leachon. Dr. Leachon, thank you also for your time. Let me start already. What are your thoughts on the decision of government to move from ECQ to MECQ?
Well, Pinky, I think it's a bitter pill to swallow for the IATF, and you can see the move of the mayors, particularly with MMDA Chair Benher Abalos, to defer it to the IATF, basically because of the lack of ayuda. And it's really counterintuitive to shift from ECQ to MECQ at almost 15,000. The 14,895 is the second highest, next to the 15,310 last April. And we know the drill that we might be suffering the consequences of that wrong decision, because the fundamental principle in slowing down the virus is basically a tighter quarantine. And I think it would be worse if we will see more lives lost than the ITF decides to shift back to ECQ. And to me, it's not a good time to relax, considering the DOH challenge right now in terms of image and all. Plus the fact that you're dealing with a different virus, a different variant, because the two surges before, the July, August last year, was secondary to one strain, that's a 614G, and the April was secondary to the UK and the two variants. But this one, Delta, this is the most transmissible and ferocious of all the variants. So it's really quite difficult, really. The best decision actually is an ECQ, an extension of the ECQ, and then do the usual playbook, Pinky, yung testing sa atin, contact basics. Pero apparently, according to the economic managers prevail this time, kasi sabi nila we're losing 150 billion a week, no? And ang problema naman natin, by computation, I think it will be cheaper. Yeah.
In the law. But so Dr. Tony, I just want to clarify. So sabi mo nga it's a bitter pill to swallow, but you do not agree that this is the time to relax the restrictions.
Yes, because I don't believe it's the time. Kasi nag-preemptive ECQ na sila eh. Sayang yung gains natin. But you know, even at the last day of their ECQ, mataas pa rin ang numbers mo eh. 15,000 and then 23% yung positivity rate. Tapos all the hospitals are full kasi 72% ang kanilang hospitalization. So counterintuitive siya, nakakatakot siya na i-open mo sa MECQ and lose lives and mag-overwhelm yung healthcare system.
And so lose whatever gains,
kasi
no? Kasi
highly transmissible yung virus eh.
That's a point I wanted to discuss with you, Dr. Tony. Because even before, when we talk about shifting to, let's say, ECQ, all the experts are already saying that it's going to take 14 days before we actually see possible gains, because of the transmissibility of the virus. But more or less, it takes about 2 weeks. 2 linggo lang po yung binigay ng gobyerno para mag-ECQ. So, ngayon na we're shifting to a more relaxed quarantine status, what happens, sir, if the cases again begin to rise after the second week, which is the start of the implementation of the MECQ?
Well, yan ang problema, Pinky, kasi magde-de-escalate sila niyan eh, which is actually more painful. Kasi nga, ang sinasabi natin, Pinky, mas luluwag ka, tapos ang taas ng cases mo, tapos highly transmissible tong variant mo eh. So hindi ko nga alam kung saan kinuha yung decision kasi the numbers na nag-ECQ tayo, preemptive ECQ ng August 6, much worse itong ginawa natin today. So sana ang ginawa natin, transition tayo dahan-dahan, gradual and phasing. And then, rather than magsisi tayo, kasi all the numbers hindi eh. So sana ginawa nila yung solution. Kung ayuda lang naman ang problema, di sana in-extend nila and you have naman the power to
extend to how
adjust the
much-
budget eh. Kahit 2
Extend
linggo
to how
lang.
much longer?
Yeah.
Extend to how
Kahit
much
man
longer,
naman extend
Dr. Lee?
another 2 weeks. So.
Another 2 weeks. Okay. Dr. Leachon, we need to take a very short break. The source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, former COVID-19 Task Force Advisor, Dr. Tony Leachon. Before we went on air, Dr. Tony and I were talking about this, what is called herd immunity. We've been used to saying that we need 70% of the population to be vaccinated so that we can achieve herd immunity. But Dr. Tony, you're saying that hindi na po 70% ang numerong tinitingnan ngayon because of the Delta variant. It has changed.
Yeah.
So what is herd
It has
immunity
changed.
now?
Yung herd immunity is the total number of
Yes.
vaccinations
What
natin in a
percentage
population
dapat ang herd immunity ngayon because of the Delta variant?
The percentage is about 85 to 90%, Pinky, based on the CDC and based on the statements of Dr. Anthony Fauci, because you're dealing with a highly transmissible variant. So magbabago ngayon yung dynamics natin dito sa Pilipinas kasi yung projection na people protection na 50%, yan ay pineg na iba yung variant bago dumating Delta. Baka dapat mga 60% ang people protection mo, tapos ang herd immunity natin ay dapat 80%. Yan aking tingin na Pinky. Kailangan itaas mo, i-adjust mo with the Delta variant.
But Dr. Tony, is it time to recalculate this because nga of the more transmissible Delta variant? I have to admit, though, that I did read something about this and I did share it with a couple of friends and saying that 70% herd immunity is really not the standard right now because of the entry of the Delta variant.
Yeah. Alam mo, Pinky, you're spot on eh. Kasi I read the India na Delta variant and then nagulat ako, Pinky. In 4 months, India has flattened the curve. From 400,000 cases, it's right now 25,000 a day. Alam mo, Pinky, ang ginawa nila is massive testing, tracing, and vaccination. They're averaging right now 9 million vaccination with a Delta variant sensitive vaccine. Ang pangalan Bharat, the Covaxin. And ito wala siyang cold chain problems eh. Kaya naisip ko kung mabibitin tayo, Pinky, with the Pfizer and Moderna that will be good for the Delta variant and Astra and Johnson & Johnson, the opportunities that we need to approve the Bharat used in India. Kasi ngayon, ang ganda ng India eh. And then this will be a cheaper one eh, so that we can achieve the herd immunity.
Is that coming from the government of India? Because there's a number of, we do know, of course, that India has the biggest pharmaceutical company for vaccines. Pero ito ho ba yung Bharat yung government supported or government sponsored?
Yes, Pinky. I think meron na tong EUA sa atin. Ang problema lang, hindi pa dumadating tong bakuna. Eh ngayon, kung okay na right now for India, this can help our target to reach the herd immunity desired for the Delta variant. Kasi I think because of the challenges in the US of reaching 93% of their population on Delta variant, siyempre, if I were the US, CDC or health officials sila, before you give out the vaccines, you have to first vaccinate muna nila yung kanilang population. So magkakaroon tayo ng challenges dun sa ating pagbabakuna. And remember, we need to recalibrate also the choice of our vaccines because 50% of our inventory basically yung Sinovac. And of course, we know naman, based on our readings, that it might be Delta resistant eh. So kailangan reviewin natin what particular vaccines in the long run that would be effective. And based also on the CNN report with Dr. Ronjen Solante, I read that particular chart it would be Pfizer, Astra, and then Bharat, and then you have Johnson and Johnson. These are the 5 drugs evaluated by the vaccine expert panel of the Philippines that will be effective for Delta variant. But I'm just thinking of another way of really helping the government in terms of achieving their herd immunity with the Delta variant.
But there's something we need to talk about that you said that there is data you said that proves that Sinovac is Delta resistant. Where did you see that, sir?
No, there are no published articles, but the movements of certain countries to move from Sinovac to another vaccine. Let's say for Indonesia, if you remember, there were few healthcare workers who died, and they were of course vaccinated on Sinovac, and then the president Joko Widodo ordered Astra and Moderna. Chile also right now shifted from Sinovac to Astra, and then order also Pfizer and Moderna. So we're not saying that it may not be effective, but because of the vaccine expert panel review, there are no published articles yet that it may be effective for the Delta variant. And some other countries are also shifting, like Thailand, Malaysia, and of course Singapore.
Right. I think it's that's the right way of saying it, that there's no published data on Sinovac regarding the Delta variant. Just a very quick question and the last one, Dr. Tony. So for those, because many have been vaccinated with Sinovac and there's no published data yet, but I do agree that Indonesia, for example, and even Thailand have been shifting to other brands. Ano po? Is it time for government, although of course there's still a big population that has not been vaccinated, but kailan ho ba gumalaw na yung gobyerno ngayon para po maghanap ng booster para sa whether it be Sinovac or more especially Sinovac and other brands? I know that Secretary Roque is saying that there's already a budget for next year for the booster shots, but should government already start dealing with possible booster shots now?
Dapat forward-looking tayo kasi 3 days ago, President Joe Biden is on the verge of approving a booster dose in the States because of the drop of the efficacy rate of Pfizer and even Moderna to about 10% less of their high efficacy rate of 95%. And because of the Delta variant, then nag-apply na ang Pfizer and soon I think Moderna in the US and then in Europe. Dapat forward-looking tayo, Pinky, because na-delay na tayo doon sa pag-order before eh. So dapat the BEP and the DOH and the FDA should be thinking of 2 things. Plan for the booster dose just in case magkaroon ka ng Delta variant and your stocks are not available for the Delta variant sensitive vaccines. Yun ang isa doon. And then mix and match, Pinky. Kailangan pag-isipan na nila ito.
Okay.
Para sa ganun, kung mabitin tayo sa supply, they will be able to find a substitute. Like
recommend.
The other day, I think yung Sputnik, no? Astra pa naman ang pinapalit. So, kailangan may ganun na tayong thinking process para once na nandun ang public, Pinky, then we can actually move forward with a sense of urgency.
Dr. Tony Leachon, sir, again, thank you so much for your time and take care.
Thank you very much, Pinky.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.